There is a very kid, you know. Bongeza solve.
Ngiyabona-ke wena bheka yabo. Usushaya iy'tayela zakho ungesila. Ndoda apha thina yabona sivela ma-TV kuma-top watch. Yena uzovela lapha ezimakhalapha.
Please, cela wenze le nto engicela mayezi. Wena uskena isi. Sirim?
To achieve the 95-95-95 targets, creative and engaging approaches are needed to strengthen HIV awareness, prevention, and treatment literacy. Bridges of Hope Training has partnered with NACOSA to introduce participatory HIV learning games, which are interactive tools that make health education practical, accessible, and empowering.
In the 90s, I was working on a program where I saw the impact of HIV and also the disconnect between knowledge and behavior. And I became fascinated by why people with the correct knowledge of prevention and transmission led to, still despite their behavior, ended up living with HIV. And came up with a few ideas, tried them out with a group of facilitators in Lusaka, Zambia. Met them again 2 weeks later and they said, wow, in these 2 weeks we've had more impact using these new tools and participatory games than we have in the last 2 years. So at that point I resigned my day job and I've been doing this for the last 25 years.
So this particular toolkit, Bridges of Hope toolkit, has been instrumental in how we engage with key populations, particularly young key populations and young people who may not necessarily understand when you talk or when you read, but they do understand when it's interactive and it's visual. So this partnership has been critical for us in ensuring that people understand the risk that they are endeavoring in, but also how to treat and prevent diseases.
The main thing, I'm gonna just break the shell. The main thing of the whole problem was to actually prevent the spread of HIV, and also maintain HIV.
Through simple activities that address HIV transmission myths, highlight how treatment work, and explain the importance of viral load suppression, participants gain clear and accurate knowledge. The games also create safe spaces to unpack stigma and identify supportive networks. Together, these interactive tools build confidence, improve understanding, and empower communities to take informed action in the HIV response. By encouraging participation, reflection, and peer learning.
Using games is the better or perfect approach to certain topics in life. So when we're using games, it's better for us to communicate certain things or talk about, especially when we talk about HIV and AIDS. When we're being too formal about it, no one is not going to listen to you. But if we are kind of demonstrating it with activities, people are more prone to actually pay attention and listen.
When we approach the Bridges of Hope, we specifically approached them because we wanted to engage young people who use drugs, young sex workers, and young LGBTQ community members. We knew that the normal IEC materials wouldn't necessarily work with them. We knew that having a trainer that talked all the time would not work for their attention spans. So we approached them to look at particularly developing or amending their materials to talk about harm reduction, to talk about risk reduction, to talk about sexualized drug use in a way that would engage them and would be interactive and long-sustaining.
But your immune system is strong. Yeah, so you don't qualify for ARTs. You can give you ARTs.
Not necessarily,
What is boosters?
not necessarily like the ARTs or ARTs. They are ARVs.
Sure.
That's what I'm saying. Because those are antiretroviral treatments.
Like in the hospital, I negative, my test that's negative. But in your test after the third time, becoming positive. And then, but you give me shoes, you window period.
The games hold the potential to enhance counseling sessions, support group activities, and community outreach. This approach may benefit interventions such as psychosocial programs across districts with a user-friendly method to build confidence, reduce stigma, and empower individuals and communities to take informed action and strengthen HIV treatment.
I was called by a friend who was attending, and he asked me that if I'm serious, I need to get some help and to take my life seriously, I should join. That's when I got to join and register myself in the program.
Kulama game lawa beniwenza ngaphana ngimfundo okuningi futhi especially lento benikhuluma ngayo mina vele nginayo and amapilisi ngiyawaphuza mara angwaphuzi ngendlela right. It's because of thini ngokushawa yini isikhathi la ngithotho kokunye nginokrema isikhathi kanti akusiyiso sesindlulile mina vele ngaphuze ngokubona kuphi angishintshi angithini ngihlala ngide way ngingakhona.
I think the most rewarding feedback I'd say is having, clients or the people that we're having sessions with participate and be able to ask questions and actually, kind of dissect, certain things in their own terms. And for me, that I think it's like a winner because we made them understand, or we're making sure that, your ears are open enough to understand everything.
The HIV is not a death sentence. That I should take my medication on time and I should eat right and not focus on me having the virus, but living life and enjoying life.
Recently, the University of Pretoria studied the use of the Bridges of Hope activities with newly initiated antiretroviral patients and followed up for a year and found that those who were exposed to the Bridges of Hope games, as they were called, 97% were retained in care, so they kept coming for the medicines, whereas normally it's about 68%.
The Bridges of Hope it helped a lot because there's less infections now. People are using spikes differently. People are taking their treatment. People are taking their methadones. A lot of guys are no longer addicts.
Nakosa strongly believes in this toolkit. We know that this toolkit can work in rural areas, peri-urban areas, with different age groups, whether they're young or old, whether they're in key populations or not in key populations, whether they're living with HIV or HIV negative. We've done this program or this toolkit within our sex worker program as well as our people who use drugs program. And the reason why we approached Bridges of Hope is because we really wanted to look at something that was fun, interactive, easy to implement in any setting with young people. And we know that this has happened because we've implemented it as far as Ekurhuleni to Nelson Mandela Bay to Umgunglovo. So we know that it can work in any space, whether it's a park, whether it's outside a school. And we know that it specifically talks about identifying your own risk, identifying your supporters to support you with psychosocial elements. So we know that this works and we strongly encourage others to use it.